Today we will discuss about ulcers. Ulcer is a localized loss of continuity of epithelium with necrosis of underlying tissue which shows little tendency to heal. Ulcers represents a chronic pathological process and differ from wounds in their prolonged course and underlying etiological factors. Surgical ulcers commonly arise due to vascular insufficiency, neuropathy, pressure, infection, trauma, or malignancy. What are the etiologies of ulcer? It could be due to traumatic ulcer, venous ulcer, arterial ulcer, diabetic ulcer, pressure ulcer, trophic ulcer, infective ulcer, and malignant ulcer, which can result due to repeated mechanical injury in case of traumatic ulcer, chronic venous insufficiency in case of venous ulcer, peripheral arterial diseases in case of arterial ulcer, neuropathy, ischemia, infection in case of diabetic ulcer, prolonged pressure over bony prominence in case of pressure ulcer, neurovascular impairment in case of trophic ulcer. Infective ulcer can be caused due to tuberculosis, pyogenic infection, and primary cancer or sometimes marginal ulcer can result in malignant ulcer. There can be different ways in which we can classify ulcers. One is vascular classification, in which it is classified into arterial ulcer, venous ulcer, or mixed ulcer. Arterial ulcer due to ischemia, due to the arterial occlusion, venous ulcer due to venous hypertension, mixed ulcer due to combined arterial and venous disease. In case of clinical classification, healing ulcer where there will be healthy granulation tissue, callus ulcer where there will be hard margins and poor healing, spreading ulcer where there will be inflamed margins or discharge, chronic non-healing ulcer which persist beyond 6 weeks. Clinical examination must be systematic and it should include local examination, vascular examination, neurological examination, and general examination in case of ulcer. So, what do we see in local examination? The first thing is site. So, whether it is towards medial malleolus or toes or pressure points, it suggests the etiology. Size and shape, irregular or punched out, it suggests whether it is venous or arterial ulcer. Edge, whether there is sloping, punched out, or averted edges, it suggests the nature of ulcer. Floor, whether there is granulation tissue, pale or slough, it suggests whether there is healing or ischemia. Base, the induration, it suggests malignancy. Discharge, whether serous, purulent, or foul smelling. It gives clues regarding infection. Surroundings tissue, whether there is any pigmentation, eczema, or callus. It suggests venous or diabetic ulcer. Coming to the vascular examination in case of lower limb, for peripheral pulses, reduced or absent in arterial diseases. Capillary refill time is prolonged in ischemia. Burgers test, this is positive in arterial insufficiency. Ankle brachial pressure index, that is less than 9, suggests arterial disease. Varicose vein suggests venous ulcer. Neurological examination, we have to do sensory testing, reflexes, and vibration sense to check for any diabetic ulcer or reduction in neuropathy or early neuropathy detection. General examination includes anemia, diabetes, weight loss, and lymphadenopathy. In case of anemia, there will be poor healing. Diabetic ulcer will be there in case of diabetes. If there is malignancy, it will be associated with weight loss, and lymphadenopathy associated with infection or malignancy. So here, venous ulcer, arterial ulcer, diabetic ulcer, malignant ulcer are the most common ulcers that are clinically seen in the surgical OPDs. So depending upon the site, pain, edge, floor, pulses, surrounding skin, and bleeding, they are classified. Only malignant ulcer causes bleeding. In case of pigmentation and eczema, it is usually venous ulcer. In case of arterial ulcer, it is shiny and hairless, and callus in case of diabetic ulcer, and indurated in case of malignant ulcer. Pulse will be absent only in arterial ulcer. Rest of the ulcers, there will be normal pulse. Floor will be necrotic in case of malignant ulcer, sloughy in case of diabetic ulcer, granulating in case of venous, and pale in case of arterial ulcer. Edge will be sloping in case of venous ulcer, callus in case of diabetic ulcer, punched out in case of arterial ulcer, and averted in case of malignant ulcer. Pain is usually painless only in diabetic ulcer. Venous ulcer, it is mild, but it is very severe in arterial ulcer and variable in malignant ulcer. Site is usually medial malleolus in venous ulcer, toes and heel in arterial ulcer, pressure points in diabetic ulcer, malignant ulcer can occur anywhere. Management of various types of ulcer. So the first thing is etiology control and limb elevation. Definitive therapy include compression bandage and stockings. Local care include regular dressing and debridement, surgery only in case of perforator ligation or vein ablation. And risk factor control like smoking cessation and if it required any medicines like antiplatelets and statins. And local care includes dry dressings and avoiding compression, angioplasty or bypass in case of uh, any cardiology issues, and amputation if necessary. Glycemic, in case of diabetic control, glycemic control, pressure relief, local care, infection, and surgery is the last option. In case of pressure ulcer, prevention through regular repositioning, air pressure relief mattress support, high protein diet, and local debridement with a flap coverage is suggested. In case of malignant ulcer, biopsy is first done to do the diagnosis with wide local excision and lymph node dissection, as well as radiotherapy or chemotherapy if it is advanced. For TB ulcer, anti-tubercular therapy with dressing, debridement if required. General principles of ulcer management: treat the underlying cause to prevent the recurrence, promotion of healing to control the infection, and restore tissue oxygenation to improve circulation, and enhance repair for nutrition, and for non-healing ulcers, surgery is required. Infection, osteomyelitis, hemorrhage, and malignant transformation and limb loss are the complications of ulcer. So to summarize, ulcer is chronic breaches in the continuity of skin or mucosa that shows little tendency to heal and arise due to diverse etiological factors like vascular insufficiency, neuropathy, pressure, infection, trauma, and malignancy. Proper classification of ulcer is based on etiology, vascular status, and clinical behavior. Bedside clinical examination forms the cornerstone of evaluation and includes a detailed local examination of the ulcer, assessment of arterial and venous circulation, neurological examination to detect neuropathy, and general examination to identify systemic illness. Treatment involves correction of underlying cause, appropriate local wound treatment, infection control, optimization of circulation, nutritional support, and strict control of systemic diseases like diabetes. Venous ulcer respond best to compression therapy and limb elevation. Arterial ulcer require revascularization. Diabetic ulcer needs glycemic control and pressure offloading. Pressure ulcer demands preventive care and repositioning. Malignant ulcer requires surgical excision. Early diagnosis, systemic clinical assessment, and targeted treatment are essential to prevent complications such as infection, osteomyelitis, malignant transformation, and limb loss. I hope you have learnt from this presentation. Thank you for watching the video.